We have lots of diabetic patients in the office and lots that come to the practice. And diabetes is a very complicated condition. I really can't cover the scope properly in one video. However, I do want to talk about one topic in particular, and that is the measurement of blood sugar. There's a few ways that we measure blood sugar in individuals, most specifically in helping to define if someone is diabetic or not. First of all, diabetes is not a problem that you just wake up with one day and you're diabetic. It's a problem that occurs over a continuum. It's a very slow progressive disease. We can watch an individual's progress down that line and see them become closer and closer and closer to the definition of diabetes. We do that in a few different ways. We can check your blood sugar with a finger stick blood sugar check, and those are pretty accurate. The problem with that kind of blood sugar check is it tells us a spot check of what your blood sugar is. Right now, today, your blood sugar is a certain amount, and that can be misleading when you're trying to give someone a diagnosis of diabetes or not having diabetes. Another test that we often use is something called the hemoglobin A1C test, or HA1C test. It's a very commonly used test. It's recognized around the nation as a reliable test for looking at individuals' blood sugars. The difference between a fingerstick blood sugar test and a hemoglobin A1C test is, number one, the places they're drawn. A blood sugar test can be drawn in the finger. An A1C test typically is drawn from a venous puncture in the arm. The big difference between the analysis of the blood, which gives us those different values, is that a blood sugar test typically can be evaluated within a few minutes. An A1C test is sent out to the lab. The lab has a very large machine. This very large machine will take an individual's or a patient's blood in, and it will actually count the sugar molecules on the red blood cell. And by doing that, it can give you a pretty good estimate of how long the blood sugar has been elevated on that red blood cell. And from that, it can calculate approximately what that individual's blood sugar value is. So we use that as a test to tell us what this patient's blood sugar has been over the last 3 to 4 months. In that regard, it's very handy because we can say, oh, this isn't just a spot check of a blood sugar. We know for a fact this person's blood sugar has been quite elevated for a period of months. So we use that value very often to help us determine if someone's a diabetic.